solve the national health crisis, we'll save tens of billions of dollars in simplifying administrative costs, insurance costs, and government regulation.
They'll argue with each other. One won't pay till the other one pays. The other one won't pay till the other one pays, you know. And the poor patient is you're bewildered, as is the doctor. And we must ensure that every American has access to quality care.
She was a passenger unrestrained.
People will wait incredible amounts of time to be seen and cared for, and they often have no other recourse.
We'll never get control of the deficit. We'll never make the economy healthy again until we bring health care costs under control.
We're caught on the horns of a difficult dilemma. Try to save money, get them out, but yet he's at greater risk of sudden death.
America's health care, going broke in style. Tonight, on the Brokaw Report, here is Tom Brokaw.
Good evening. We've heard about it and read about it, and a lot of us have experienced it. We're having a health care crisis in this country. We have the best doctors and the best hospitals in the world, but the system isn't working. 35 million Americans, maybe more, have no health coverage. Medical costs are rising more than 10% a year. They're a cancer on the national economy. Bill Clinton is determined to change that. Just this month, the insurance industry admitted it needs to reform. It's ready to back universal health coverage. We've got to change because we're going broke. How did the medical system get out of control? Well, lots of ways, it turns out. What drives cost? Just about everything. Doctors, patients, insurance companies, hospitals, lawyers, and the daily drama of big city emergency rooms. An 18-year-old shot in the leg. His friends have brought him in, but they can't agree on how he got shot.
It looks like a single gunshot here.
The emergency room team works furiously to save the leg, to stop the bleeding. At the same time, police find dozens of crack vials in the victim's pockets.
He's now officially a prisoner.
Okay, let's go. Right in here.
Minutes later, a heroin overdose arrived. Then a medication overdose.
She was a passenger unrestrained.
A traffic accident victim.
Remember what happened?
The emergency room is incredibly busy, but never frantic.
You guys all right over there?
Yeah, we're fine.
No time for small talk.
You're in the hospital. You're going to be all right.
It is a routine day in Temple University Hospital's ER. A day that mirrors the violence and crime and disease of the surrounding inner city streets. And then there are the sick people. The poor sick people who come to this emergency room for what doctors call primary medical care.
Might be a virus. Your throat looks okay.
Have a seat in the waiting room and the doctor will come out and call you.
When the traumas hit, they have to wait. And it's hard to wait when you're sick and you don't think anyone cares.
How you doing, sir? I'm Dr. Cardell.
Emergency rooms like this one have to see everyone who walks through their doors. People with colds and headaches and stomach pains. All at the same time, it tries to put back together the blasted and torn victims of the wars on the city streets.
A physician philosopher once said that practicing medicine gives you a front row in the theater of life. I think the emergency room takes you backstage. It really gives you life in its rawest form.
What happened? Trauma 1, a little help in here?
Friday or Saturday night, it's the last place you should be for what's a routine problem. It's a gross inefficiency of the healthcare system, and I understand what they're trying to do, and I wish there were another way. Gunshot wound left neck. He has a pulse, but it's going quick. We're losing his pulse.
A young emergency room doctor, great at what he does, and what he does can cost you money, even if you never go near the emergency room. We'll show you how when we come back. Today's hospitals look like something out of science fiction. Sophisticated machines and medical teams on alert to treat every medical problem. And if you have a serious accident, a violent injury, experts say the best place to go is an inner city emergency room. It may be in a rundown neighborhood, but the emergency room teams in the inner city are the best. The problem is that they have to do a lot more than treat emergencies.
Can we get monitors ready? Let's get a scalpel.
15-year-old Diana Ortiz arrived at Temple's emergency room with no vital signs. Moments before, she was hit in the head by a stray bullet. Another innocent victim of North Philadelphia's vicious drug war.
We got an entrance one, Rose, right cheek.
Attending physician Tony Cardell and his team worked on the girl for half an hour. The last desperate attempt to save her.
I think you could have justifiably done nothing. but we made every effort to give the benefit of the doubt and attempted everything we could.
No expense was spared. It's possible Temple will never collect the $1,400 in medical costs. The hospital will consider this a charity case, like many other shootings, fatal shootings, that are now part of the daily routine in the emergency room, the ER. However routine, Diana's youth and apparent innocence did get to the team. When they couldn't save her, they were depressed. But 10 minutes later, after Diana Ortiz was pronounced dead,
This looks pretty classic for an allergic kind of reaction.
Dr. Cardell was back at work with an allergy case.
I think it's dehumanizing to not be able to think about an individual death in its full implications. And it can be aggravating at times if you need that space, that psychological time just to cope. How you doing, sir? I'm Dr. Cardell. On the other hand, it can be diverting to have to take care of another patient, however trivial the complaint. Squeeze my fingers. People will wait incredible amounts of time to be seen and cared for, and they often have no other recourse.
No other recourse because most of Temple's patients are poor. Some of the tens of millions of Americans without private health insurance.
It doesn't hurt anymore?
Mary Bryant is here with her son. He may have fractured his toe. She has no insurance. This is where she comes for any complaint, even a cold.
Temple stays open all day, like 24 hours a day. You can come in anytime you want to, you know.
Temple charges $185 minimum to be seen in the ER. But Mary Bryant can pay nothing. Little Tyrone Harris has had diarrhea for 4 days. His mother says the emergency room is more thorough than her local clinic. A pediatrician is called in for a second opinion. A battery of tests is ordered. Tyrone's hospital bill will come to $887.30. Temple will absorb most of that cost, but it will be partially reimbursed by Medicaid.
He doesn't have a fever now.
Patients like Tyrone and Mary Bryant's family crowd inner-city emergency rooms across the country. Sometimes they have to wait 6 to 8 hours. Sometimes they grow annoyed and leave and return in worse shape, like this man with stomach cramps.
My patients just ran short. Now here I am all over again.
Sir, what's your name?
Others come in only when they fear they're at death's door. Elwood was beaten badly a week ago, and his pains won't stop. He's afraid that his one remaining kidney may be damaged. He lost the other kidney when he was shot. Elwood says he's homeless.
Okay, Elwood, there's no bruising around your kidney, which is good.
His Temple cost will run to more than $3,000, and the hospital hopes to get him on Medicaid for at least a partial payment.
So what you should do is just go home, all right? And for 24 hours, just put ice on your ribs, all right? And we want to see you in 3 days.
But Elwood has no bed, no ice, no home. The emergency room can't do anything about that, and Elwood never came back for a follow-up. Speaking of the whole patient population here, do you do health care or do you do sick care in a place like this?
Predominantly sick care. Predominantly sick care.
Just taking care of their immediate needs right now.
Right.
And then getting them on their way. Dr. Fred Kaufman is director of Temple's ER. When a patient comes through that door in terms of immediate and major care, does cost enter your mind?
Absolutely not.
But practicing sick care is more expensive than practicing health care, especially in the emergency room, which is equipped with state-of-the-art technology to deal with traumas, where patients usually arrive without medical records.
Because when people have new seizures, there are a number of tests that should be done. It sounds like those tests have been done.
This woman thinks that she has had a seizure. During the past year, she's been tested at 3 different ERs for the same problem, but there are no permanent records. She doesn't know how she's been diagnosed. Temple will likely repeat thousands of dollars worth of tests to make a diagnosis.
Well, you know, it'd be real great if you could get a hold of those records from the other hospital.
She is on Medicaid, but that will cover only part of the cost. Last year, Temple gave $20 million in free or partial payment care. Fine inner-city teaching and research hospitals, like Temple, stay financially solvent only by appealing to the privately insured patients from outside the neighborhood. They offer specialized procedures not often available in suburban hospitals. heart and bone marrow transplants, hip and knee replacement surgery. Hospitals like Temple need patients who are fully insured to help pay for the cost of those who come in here not able to pay for all of their care or not able to pay anything at all. This is called cost shifting. Shifting the cost of those who can't pay anything at all or those who are underinsured to those who are fully insured.
Medicaid has traditionally underpaid. So the answer to your question is, if it costs $100 to deliver a service, the charge to a commercial insurer might be $200.
Temple Hospital Vice President Dr. Leon Malmood says while there is a fixed charge for each medical procedure, reimbursement to the hospital varies depending on one's insurance. It sounds to the casual viewer or listener like healthcare in America has become one massive shell game. Shifting, 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 shifting.
I don't think it's a shell game. I think it's a game, if you wish to call it a game, of desperation.
Survival also means going into the community practicing preventative medicine. 60% of the babies born at Temple are high-risk pregnancies. Some are premature. Others are suffering side effects from the mother's drug abuse. The mothers frequently have had no prenatal care.
Your blood pressure is fine, okay? Do you ever have any problems with being anemic, though?
Temple is trying to change things with a program that seeks out pregnant women, new mothers, and their families, promoting health care and childhood immunization.
Very good.
Temple expects that healthy baby and child care will pay off quickly.
And we'll be back again when the baby is born.
By reducing the demand for sick care and easing the pressure on the emergency room.
Do we have blood yet, Rose?
Right now, that pressure is terrific. The burnout rate is very high.
Just want to propose a toast here. The best damn ER staff anywhere.
This is Tony Cardell's last night in the ER. He's accepted a cardiology fellowship in a town where he hopes the work will be less stressful.
You're going to be the last patient I officially take care of at Temple. Return if you feel bad. And no more alcohol or cocaine.
ER physicians such as Dr. Cardell, who are stressed and exhausted, move on.
Good luck to you, Tony. Take care.
The emergency rooms and hospitals remain.
120 calls.
They will continue to be packed and pushed and challenged. So far, they've been able to defray costs by keeping a fragile and tangled system of bookkeeping and cost shifting. But sooner, not later, emergency rooms will reach the breaking point, and someone will have to pay. Fact, the United States ranks only 22nd in the world in the rate of infant survival. Another fact, as many as 60% of American children under 2 are not adequately immunized against childhood diseases. When we return, so you wish you were a doctor? Well, a lot of doctors say red tape and lawyers are driving them nuts.
I play by the rules, but I am obstinate enough to say that if I don't like your rules, I will take my marbles and go home.